Hello, my name is Liam Barber and I am a clinical exercise physiology student at the University of New England. Today I will be talking to you about arousal in sport. This will include explaining what arousal is, how it influences sporting performance, some of the theories on arousal, and finally, how anxiety can become implicated with arousal and the resulting impact that comes from this. Arousal is one of the major metaphysical influences on sporting performance. It is commonly focused upon in both sports psychology and in mental training in athletes. Arousal in this context may be defined as general physiological and psychological activation associated with physiological changes. In layman's, arousal may be described as an individual's readiness for action. As individuals' levels of arousal change, there are a whole host of psychological changes that take place. As a general rule of thumb, higher levels of arousal are associated with increases in heart rate, ventilation rate, sweating, and blood pressure. This provides a holistic state of readiness to react. This is ideal for the majority of sporting activities. However, there is no proven theory on the way arousal works. As such, several theories have been developed. Earlier theories focused on arousal itself. However, later theories have focused on other factors such as anxiety. The drive theory, contributed to Hull in 1994 and Spence in 1966, says that increased arousal leads to more dominant performance. Through this, they explained that in well-learnt skills, the performance improved with arousal, whereas the skills only just being learnt, performance degraded with arousal increase. Through this, they explained that in well-learnt skills, the performance improved with arousal, whereas the skills only just being learnt, performance degraded with arousal increase. This theory is criticized due to the fact that it is inaccurate for complex motor skills. Also, more recent data fails to comply with the high arousal, high performance trend in well-learned skills. Inverted U theory says that there is a kind of happy medium with arousal. To this end, Yerkes and Dodson, 1998, formulated parabolic representations of ideal arousal for performance. This theory is perhaps the most commonly known, as it is taught in many schools' curriculums. The idea is that a moderate amount of arousal is ideal, with variables such as skill level and task complexity changing the peak position on the graph. However, the major criticism for this theory is that it is too simplistic. For example, arousal change to performance isn't as gradual as displayed, nor is it accurate for every skill, and takes no notice of individual variation. The Individualized Zone of Optimal Functioning, or the IZOF, coined by Hannon between 1980 and 1999, believes that for each individual there is a personalized level of arousal that is ideal for performance. It is commonly displayed on a bandwidth of arousal and indicates where an individual will best perform. Downsides to this theory are that it is incredibly hard to identify for every individual, as well as the fact that different skills would require a varying zone of optimal performance. Multi-dimensional anxiety theory suggests that both cognitive anxiety and somatic anxiety are related to performance, and in different ways. This presents increased cognitive anxiety as decreasing performance, and increased somatic anxiety following the inverted U trend. This theory addresses the differences between the dimensions of anxiety, and by extension arousal. Optimal performance is described as a state where mentally there is little anxiety, and somatically there is a medium amount of anxiety. Or more simply, that all the arousal is working physiologically rather than mentally. However, research has so far been inconsistent on the theory. Similarly, the catastrophe theory involves cognitive anxiety, but how it relates to arousal. According to this theory of Fazey and Hardy, 1998, ideal arousal for performance will follow the inverted U trend. However, this is only if the individual's cognitive anxiety is low. As the cognitive anxiety increases, there is an increasingly steep decline in performance immediately following the optimal level of arousal. Therefore, if the individual mentally feels higher levels of anxiety, the leeway on too much arousal decreases and leads to a large fall in performance. Apter in 2001 and Kerr in 1985 and 1997 coined the reversal theory. This involves arousal's influence on performance relying upon the individual's own perception of their arousal. If the individual perceives their arousal as pleasant, increased arousal leads to improved performance. However, when the individual perceives their arousal as unpleasant, it has a negative impact on performance. There is also an aspect to this theory that says when in a serious mood, less arousal is more pleasant, and that when in a playful mood, more arousal is more pleasant. This theory has little supportive research, however. Finally, the anxiety direction and intensity theory focuses on both the intensity of anxiety, as well as whether the individual perceives the anxiety as facilitative or debilitative, which is termed as direction. This theory suggests that the direction of anxiety will determine whether it improves performance or degrades it, and the intensity will determine to what degree. However, this theory only has inconsistent research supporting it. As stated, more recently developed theories involved anxiety as well as arousal. Anxiety is a state of mind that is associated with and sometimes a byproduct of arousal. It is related to feelings of nervousness, worry, and apprehension. This typically occurs during situations of high arousal. Anxiety is separated into trait, an individual's natural anxiety levels, and state, which is dependent on the situation, and is what is typically related to high arousal. Anxiety is caused by a number of reasons, including a lack of confidence, perceived pressure on the individual, and an individual's own expectations. Anxiety is commonly seen as a negative influence on performance. However, as a few of the theories suggest, somatic anxiety may be beneficial, as it is by definition improving the same physiological factors as arousal. In conclusion, there is no round consensus that arousal is an important and beneficial influence on performance. However, exactly how it leads to ideal performance and how the interplay of anxiety impacts this is a contentious topic that is much debated by academics. For any individual athlete, my advice would ultimately be to find what works for them and continue with that approach. Because if there is anything that research agrees upon, it is that when utilized correctly, arousal is imperative for the best performances. Thank you.